And we begin with a problem that just keeps getting worse. A big delay in reimbursements from Iowa's Medicaid operators. Tonight, some healthcare providers don't know how they'll pay their employees. Fox 28 News reporter Nick Weig has been tracking this story all week. He joins us right now. And Nick, this would be awful if workers don't get paid.
Yeah, that's right, Christopher. The main issue right now is a system-wide glitch that has nearly halted all reimbursements from one of two Medicaid providers in Iowa to those who provide health services to patients. But everyone agrees this is just the biggest example of a much larger and unsustainable problem.
50,000 is about equivalent to one payroll, so for us to have over 100,000, that's basically over a month's worth of payments.
Roger Getkin is the executive director of Successful Living, a group that works with Iowans battling chronic mental illness. He calls the lack of payments from AmeriGroup a hardship, but admits others are in far worse shape.
I know another agency that's probably not going to make payroll because of this.
Well, we were able to meet this last cycle of payroll needs.
Joshua Weber took out a loan to pay his 18 workers, but without reimbursements, there is no plan B.
If it's not fixed, this glitch in the next 15 days will impact our ability to pay our employees.
That glitch is preventing AmeriGroup from reimbursing providers who service Medicaid patients, but the problems go far beyond that.
Before we got involved with privatized Medicaid, things were very smooth.
Most claims were taken care of in about 3 days, but now it takes nearly 5 times as long. Part of the problem, Denninger believes, is that then Governor Branstad promised 4 private operators would manage Iowa's system.
One was out right away. Shortly thereafter, one left, and then it took quite a while for another one to be added, but then one left again. So it's just been a roller coaster for both the providers and for the patients.
I asked everyone if they have seen anything work better since Iowa switched to the privatized system.
No.
I'm a little bit hard pressed to find the specific, like, this is so much better. I wish I could.
I'm going to preface this by saying no, because the private option is up against a very, very good state-run program before we went over to privatized Medicaid.
Now, I reached out to AmeriGroup, who says the processing issue is affecting a limited number of care providers, and they are, quote, working hard to resolve the issue. Now, I do want to point out that generally people we spoke with today don't seem to have animosity towards the Medicaid operators like AmeriGroup themselves. Instead, they're critical of the program everyone is now left to operate under. Nick Weig, Fox 28 News.